You might be wondering, who can provide information and where should you go if you have cancer symptoms? Bleeding from the vagina between menstrual periods or after menopause. Any lumps on the breast. Changes in bowel movements. New lumps in the neck. Hoarse voice for more than 2 weeks. Unusual nosebleeds or loss of hearing or ringing in the ears. Ulcers that do not heal or lumps or white and red spots in the mouth. Persistent pain or discomfort in the tummy area. Persistent cough and bloody phlegm. The first doctors you can refer to are the doctors in government health clinics or private clinics nearby. In health clinics, there are doctors who are known as general practitioners or GP in short. There are also specialists in these clinics who are known as family medicine specialists. They will be assisting you with various health issues, including cancer-related concerns in general. If necessary, the GP or family medicine specialist will refer you to the specialist related to your health issues. Let's take a look at the specialists who make cancer diagnosis. General surgeons at surgical specialist clinics. They will be in charge of breast problems, lumps anywhere in the body, changes in the bowel movements, or sudden weight loss. Internal medicine specialists or physicians for stomach and bowel problems and lung issues. Gynecologists for women's health issues. You might also be referred to a more specialized doctor or known as a subspecialist for your specific problem. Breast surgeons for breast cancer diagnosis. Colorectal surgeons or gastroenterologists for colorectal cancer diagnosis. Pulmonologists or respiratory specialists for lung cancer diagnosis. Gyne-oncologists for issues related to a female reproductive system. Oncologists are usually referred after the initial cancer diagnosis was made by the mentioned specialists. If the cancer is incurable and can only be controlled, palliative care becomes crucial. Palliative care specialists. The palliative care specialists include the doctors and nurses. They are referred to for the emotional and physical well-being of patients when cancer has spread. They can help improve the quality of life by reducing pain and assisting with daily life. Every cancer patient and family member has a right to receive treatment and support to alleviate suffering. Palliative care is provided in hospitals and also by NGOs in the community, sometimes called hospice care. Do remember, stay alert to your health. If you experience new symptoms, do not delay seeing your family doctor. Your doctor should schedule an appointment with a specialist or a subspecialist within 2 weeks. Screening tests for early detection of cancer. For screenings and regular checkups, consult your family doctor or family medicine specialist. Screening is a way to detect cancer before it causes any symptoms. There are many benefits if cancer can be detected early. Treatment is easier, more affordable, and the recovery rate is higher. If you have a high risk, such as a family history of cancer, you are strongly encouraged to seek advice from a doctor in a clinic. For those at low risk, you must undergo screening. This includes breast, colorectal, and cervical cancers. Cancer risk increases with age. So, after the age of 50, regular screening can be done. Please refer to our previous videos for the respective screening methods. Medical costs. You might be concerned about how to cover the cost of diagnosis and treatment. All tests and treatments can be done at Ministry of Health hospitals and medical centers under the Ministry of Education or universities. For those with limited financial means, Ministry of Health hospitals provide significant subsidy facilities. Costs in university hospitals are usually slightly higher, and in private medical centers, they are even higher. If you are able to afford it, you are encouraged to take out your health protection insurance that can be used for treatment at private hospitals. Always prepare for a rainy day. The Malaysian government provides many aids for the B40 group. Peka B40 screening can be done at private clinics without any charges. Among the government aids, please refer to the following video links.